Okay, everybody, Dr. Rafich here from Vet Triage. We are starting a brand new journal, Veterinary Surgery from 2022. And this one is going to be about horses, the current use of biologic therapies for musculoskeletal disease, a survey of board-certified equine specialists. This comes out of Michigan State University and Colorado State University. Okay. Objective: to evaluate the use of mesenchymal stem cells, autologous conditioned serum, platelet-rich plasma, and autologous protein solution for the treatment of equine musculoskeletal disease by board-certified surgeons or by board-certified sports medicine and rehabilitation doctors. They had a survey they created with 59 different questions. The results found that the years in practice and the type of practice were not associated with the biologic therapy used. Platelet-rich plasma was the most common therapy used at 87.5%. Platelet-rich plasma and mesenchymal stem cells were most often given intralesionally, while autologous protein solution and autologous conditioned serum were most often administered in the actual joint. The autologous conditioned serum at 48.1% was repeated commonly within 2 weeks of injection. Mesenchymal stem cells at 43.3% and platelet-rich protein at 38% were commonly repeated 1 to 2 months after the initial injection, and the autologous protein solution was repeated over 4 months after initial injection at 39.6%. Local inflammation and expense were the most common adverse and limitations for use. Okay, introduction. Mesenchymal stem cells, platelet-rich plasma, autologous conditioned serum, and autologous conditioned protein are biological therapeutics. They are defined by the National Institute of Health, the NIH, as treatments that are substances made from living organisms to treat disease. They can occur naturally in the body or made in the laboratory. While under the FDA, Food and Drug Administration, these therapies do not come with a label for approved conditions, dosages, route administration, unlike medications which are previously approved by the FDA. Previous surveys of equine practitioners have focused on intra-articular administration of biologic therapies in addition to non-biologic therapies, and these include polysulfated glycosaminoglycan, hyaluronic acid, and steroid therapies. Materials and methods. The survey and the study was approved by the Michigan State University Human Research Protection Program. It was voluntary and participants could refuse answering certain questions they wanted to. The survey was developed by 4 co-authors, evaluated by 5 individuals who were not included as investigators. Okay, so first up is going to be the demographics. I'm going to show you this chart here for those who like this kind of data and who feel compelled to pause to look at it. It is, of course, very small font. This is a summary of respondents who were, the adipose-derived mesenchymal stem cells for those practitioners who have been in practice for over 10 years. They never use these in 62% of the respondents, and 18% of the practitioners for over 10 years of practice did use them. Those in academia, 45% never used. Private practice, 12% would use them. As far as bone marrow-derived mesenchymal stem cells, people over 10 years of practice, 23% said never use, a 57% confirmed usage. Academia, 37% use it, and private practice, 36% use them. Platelet-rich plasma, for those over 10 years of practice, 10% said they never use it, 69% do use it. Academia, 45% use it, and private practice, 43% use it. For autologous conditioned serum, over 10 years of practice, 18% never use it, 61% use it. Academia, 37% use it, and private practice, 43% will use it. And then finally, the autologous conditioned protein solution, over 10 years of practice, 38% use it, 40% don't use it. Academia, 31% don't use it, and for private practice, 27% do use it. All right, so then 80% of the respondents have been in practice for over 10 years. Most were board-certified surgeons at 80%, sports medicine specialists 4.5%, specialty in both 15.5%. 46% of folks work in equine only private practice, 26% academia equine only, and 25% academia large animal practice. Here's another chart for folks who are interested that we'll go over now. So the biologic therapy and percent of respondents who use it at least once a year. You have the adipose-derived mesenchymal stem cells at 19.5%, so they use it at least once a year. Bone marrow-derived mesenchymal stem cells, 72.1%, use it at least once a year. Platelet-rich plasma, 87.5%. Autologous conditioned protein solution, 46.2%. Autologous conditioned serum, 79.7%. And as far as administration goes, intra-articular, intralesional, intravenous, or other. For adipose-derived mesenchymal stem cells, 54% in the joint, 76% in the lesion, 29% intravenous, 12% other. For bone marrow-derived mesenchymal cells, you've got, the same percentages. Okay, they lump those together. Platelet-rich plasma, intra-articular, 68%, intralesional, 97%, intravenous, 4%, other, 14%. Autologous conditioned serum, 98% intra-articular, 15% intralesional, 5% intravenous, 8% other. And then finally, autologous conditioned protein solution, 46% in the joint, 17% intralesional, 2% IV, less than 1% other. Okay. The most common type of horses treated were sports horses, so dressage, show jumping, eventing polo at 44%. This is followed by Western performance like cutting, reining, working cow, and rodeo at 24%. As far as frequency of use and reasons for use, the primary reason for choosing biologic, 56% said based on scientific literature and data, 20% say based on personal experience, 10% because other treatments didn't work. For platelet-rich plasma, the most commonly used at 87.5%, followed by autologous conditioned serum at 79.7%, and then bone marrow-derived stem cells, 72.1%, autologous protein serum, 46.2%, and then adipose-derived mesenchymal stem cells, 19.5%. Another chart here we're going to go over for those who want to pause it and look at those numbers. Frequency of repeated administration. So mesenchymal stem cells, they rarely repeat it in 49%. Platelet-rich plasma, rarely repeated, 49.2%. Autologous conditioned serum, commonly repeated at 41.5%. Autologous conditioned protein solution, 56.4%, never repeated. And then as far as how often they will give it again, mesenchymal stem cells, 1 to 2 months after the injection was most common at 43.3%. Platelet-rich plasma, same thing, 38% were given 1 to 2 months following the initial injection. Autologous conditioned serum, 48.1% were given within 2 weeks of the initial injection. And then autologous conditioned protein solution, 39.6% were usually given over 4 months following the initial injection. So when asked the primary reason for choosing biologic treatments, we went through that already. Duh. Here's another chart. These survey studies are useful to some degree, but they do have a lot of data with them, so I'm trying to figure out what's most important for you guys who care about this, what you want to know. For limitations of use, biological therapy, mesenchymal stem cells, expense was number one at 73.1%, and then for negative effects, 83% found local inflammation at the injection site. For platelet-rich plasma, 56% said expense was the biggest problem, 86% found local inflammation at the injection site. For autologous conditioned serum, 66% said expense was the problem, 65.3% local inflammation. And then finally for autologous conditioned protein solution, 75.4% expense, and then 55% said local inflammation. So in regards to repeated injection and injection protocols, 89% of respondents who use platelet-rich plasma said they frequently repeat injections, But for autologous protein solution, mesenchymal stem cells, and platelet-rich plasma, 25%, 20%, 40% respectively said they only repeated those injections. And then for treatment with mesenchymal stem cells, 43.3%, and then for platelet-rich plasma, 38%, most commonly repeated 1 to 2 months after initial injection. In contrast, using autologous conditioned serum, repeated within 2 weeks of initial injection, 48%, or 2 to 4 weeks at 42%. And then for those who repeated autologous protein serum injections, they usually did it over 4 months after the initial injection at 40%. As far as limitations for use, we said this already. Expense was a big one. And then, of course, negative effects from these products. Mesenchymal stem cells at 56%, platelet-rich plasma 59%, autologous conditioned serum 42%, autologous protein solution or serum 20%, and local inflammation was the biggest negative effect. Okay, discussion. Platelet-rich plasma was the most used, and with both platelet-rich plasma and mesenchymal stem cells used most frequently to treat tendon and ligament. Autologous conditioned serum and autologous protein serum were more commonly used intra-articularly. And then local inflammation at the injection site was a common issue. In 2009, there was a study. 54% of respondents from a survey of equine doctors said they used autologous conditioned serum. In 2018, another study of rehab modalities by equine vets said there was an increase of biologic therapy use, with most people using either autologous conditioned serum at 81% or platelet-rich plasma at 87%. Platelet-rich plasma is almost often used probably because it's user-friendly, stall side, products are more commercially available, whereas autologous conditioned serum and mesenchymal stem cells are not available stall side and require incubation of 24 hours and then several weeks respectively. Autologous protein solution also provides the convenience of immediate use, whereas this technology is newer than platelet-rich plasma, autologous conditioned serum, and mesenchymal stem cells, and requires a specialized centrifuge. The vast majority of veterinarians indicate that they most commonly administer platelet-rich plasma intralesionally in tendons and ligaments. Another study in 2017 said the effects of intralesional injections with autologous bone marrow-derived mesenchymal stem cells or adipose-derived mesenchymal stem cells or platelet-rich plasma on surgically induced superficial digital flexor tendon lesions found similar healing outcomes with mesenchymal stem cells and platelet-rich plasma. In this study, large animal specialists indicated that both platelet-rich plasma and mesenchymal stem cells were frequently used for tendon and ligament issues. The respondents also said that cost was a limiting factor. Autologous conditioned serum and autologous protein solution were most commonly administered intra-articularly. 46% of respondents said that the use of autologous protein serum at least once per year is used. Unlike autologous conditioned protein solution, autologous protein serum has also been proven to be effective in reducing lameness in horses in previously diagnosed osteoarthritis of high motion joints. Local inflammation was reported more commonly with mesenchymal stem cells at 83% and platelet-rich plasma at 86%, then the autologous conditioned serum at 65% and autologous protein solution at 55%. Infection at the site of injection was the second most common adverse effect reported for all biologics. And that's that. So yeah, I mean, the main point of the paper here really is to, number one, for veterinarians, there are multiple options of biologics, and you can clearly see the protocols are all over the place. So you're kind of going to go based on whatever literature you have access to, but also your own personal experience, either yourself or with colleagues who have used these products before, to see what the highest success is for frequency and all that. Obviously, there's your expensive, but equine medicine is expensive in general. And then there's no surprise that inflammation is a common side effect there. And then for horse owners, realize that there's plenty of options for different therapies, but realize there's no standardization. So just because one equine vet does it in one way, another equine vet does it a different way, doesn't mean anybody's right or wrong. It just tells you that we need more studies on this stuff. And because these things are not as closely monitored by the FDA as like medications, it's going to be hard to have studies on these things. So just be patient with the veterinarians and realize there's more than one way to treat these horses, and there's also no standard for it. All right, guys, we'll see you in the next video. Take care.